EOI, Endodontics, Oral Surgery, and Dental Implants Rehabilitation of New York City. Next Level Dental Care.
So some of you might know me. I'm Nima Dayani. I'm an endodontist in the group. I've been in New York City for about 17 years. I did my undergraduate dental training at Stony Brook. I spent another year of GPR doing there. And then I moved on to Temple to do my postdoc in endodontics. And while I was there, I also got a master's in oral biology as well. Since 2002, I've been in Midtown Manhattan area. We are on 44th and 5th Avenue. And we used to meet once a month in my office, our office. We have a conference room and about usually 15 to 20 people showed up. And we did graduate seminar style cases where there were a few specialists, one represented from each field and a lot of general dentists, and we all discussed the cases and we saw things from perspective that we wouldn't see otherwise. When the pandemic happened, we did a webinar online, and since then there's been interest in it, and we've gone to once a week, every Tuesday morning, 10 to 12. We have the time on our schedules reserved, and we come here. There are usually very interesting cases. As you can see, we've gone away from clinical sciences today to the practice of dentistry. We have a very distinguished panel here that I'm going to introduce them in a few minutes. And I believe today we are north of 100 people, 98, but about 120 have signed up and people are trickling in. So that's quite an honor to have you here. The whole idea behind today's lecture, just so that you know how it happened, at the beginning of the pandemic, I heard that Goldman Sachs decided to release about, I don't know, about 1 million or 100,000 N95 masks to the local hospitals that they had reserved. And it occurred to me that a company that is in finances has planned so well in advance that even if a virus strikes, they have enough reserves to take care of their employees. And here we are, I don't know about you guys, but I'm speaking for myself, a small business. I was totally caught off guard that, oh my goodness, we can't come back to work starting 2 days from now. Thanks to the group that we had at Sphere Study Club, and we have a chat room on WhatsApp that we meet up. I think most of us decided in consultation with one another to close a week before ADA came out with the same exact conclusion that we need to close and protect ourselves, so we'll be here for the next 20 years, happy and healthy, seeing patients and helping the public, as opposed to the next few weeks. So the study club has helped me a lot, and it hit me that we need to be planning just as much as a very well-organized, larger organization like Goldman Sachs that had every contingency planned so that we are not caught off guard. It seems that the consensus say that this isn't going to go away tomorrow, and that in fact is going to have peaks and valleys of surging and going back down. Hopefully they're all wrong and this is gone by the end of May. But in case it's not, I was thinking that I should have the most pessimistic plan ready in my office and the most optimistic plan, and hope for the optimistic one. But most likely I'm going to wind up someplace between the pessimistic outlook and the optimistic outlook. So I reached out through some banker friends, and who they put me in touch with Small Business Development Corporation, who is an affiliate of SBA, asking a lot of difficult questions, and then decided to bring them to the group to talk to everybody. And of course, there is always a legal component that accompanies everything. And given the nature of this pandemic, for this generation, it's the first time we're dealing with something of this magnitude. You could see that it's changing day-to-day basis. So we also have a very distinguished attorney on the call with us today that's going to come in our second hour. So the group from Small Business Development Corporation that's based in Staten Island is led by Mr. Dean Balsamini, who's on the call, and I'm going to give him the microphone in a moment, and he'll introduce his team. We'll go first. They're going to talk 5 minutes to an hour, depending on their presentation. And then after that, Ms. Felicia Ennis will come on, who's an attorney, and I will give an introduction about her at that point. We are going to be holding the questions after Mr. Balsamini's and team's presentation, because in case there are some legal questions, we think that Ms. Ennis will probably cover some of that items anyway. And then at the end of it, we will have a joint Q&A. So if each person goes about 50 to 45 minutes or an hour, we should have time to cover all the Q&A also. Remember to use your chat room to put the questions there so other people will probably see what the questions are coming up. And at the end, we turn to you and we'll review the questions and answer them. Everyone's going to be muted. Just don't forget to unmute yourself when we call on you to ask questions. Mr. Balsamini, thank you for joining us this morning. I'm going to turn the microphone to you so you can go ahead and talk a little bit about yourself and your team and start with your presentation. Mr. Balsamini, are you on and can you hear me?
I need to unmute. Okay, can you hear me now?
Yes, we can.
That's great. We were all muted, I believe. Well, I want to say again, good morning to you and your colleagues. And first, allow me to applaud you and your colleagues. I'm very impressed that you've taken the initiative to prepare for your return to the individual practice. And that's, of course, to your businesses. And it is a business. Our hope is that we will all return together very, very soon. And I'm very, very happy that, you know, we're doing this today with you. Next slide, please, Megan. One of the things that that is very, very important as we talk a little bit about the Small Business Development Center is the team. I have a great team that's been with me for many years, but this is not our first initiative. We've done this. I've been with in another life. I was with AT&T for over 35 years. I ran our international and business in Asia Pacific, and also was involved with our marketing and financial initiatives in our headquarters in Basking Ridge, New Jersey, and other arenas. After that, I came over to the College of Staten Island as an adjunct professor, and now been running the Small Business Development Center, which is really an initiative, and it's based at the college. Primarily, one of the things that's really, really important is that you have a great team. And my team members are Megan Ernst, Megan Barron, who just got married, Joe Bottega, who'll talk about the SBA programs for COVID and the financial assistance. He's a certified business advisor, as are all my advisors. And also, we'll talk about George Telmani, a certified business advisor who in another life was also a business owner in Manhattan. So let me talk a little bit about who we are in essence. One basic thing is that I'm responsible for all of Staten Island and also a piece of Southwest Brooklyn, which is our 11th, the whole area is our 11th congressional district. So we have a sizable footprint. And in addition to that, there are a number of different contacts and clients that we handle every year. Right now, we have a base of about 1,800 and also about 600 new clients every year. So it gives us an overview of the initiatives that take place, what are some of the areas of concern, and so forth. So who we are, we're a free resource. Free always has people scratching their heads, but yes, we're actually a free economic good to the community. We're based in a university setting, which gives us the opportunity to also work with people in our incubator at the college. I have 3 locations. One right now is at our incubator, and the other is over in Brooklyn, and the other physically at the College of Staten Island. However, having said that, for the last 6 weeks, and we actually left the offices a week earlier to all do, we're working at home and working in initiatives. I have a call every day at 4. I review what's going on during the day. How are we doing? What's the nature of the clients, and so forth and so on. To me, during this period of time, communication is extremely vital. What do we offer? Business planning is extremely important. Disaster recovery and actually building blocks to take you out of it. This is not new to us. We were involved with 9/11. We were involved with Superstorm Sandy, and but this one has taken on a totally different shift since it's affected everyone in the country and pretty much everyone in the world. So what is it that we can do? And we talked about that. I think some of the things that you're just listening to, some of the practices briefly, you're very vital to the community. You very obviously provide one-on-one services. We've seen hundreds and hundreds of clients. For example, on Staten Island, there's over 9,000 businesses, but giving you a perspective of Staten Island and Brooklyn, a lot of them are mom and pop type operations. A lot of them are one-on-one situations such as salons, such as small restaurants. You pick one which involves a lot of one-on-one, similar to what you were doing, of course, in a different vein. The next slide, Megan. What also is important is that on the prior slide, we provide and can assist you with market research and also with, dealing in the real world at this point in time with digital marketing efforts and what have you. And that's extremely important as we work through our social media. I hate the term, but it's used. So new norm implies so many different things that we have to look at and how we work, how we run our business, keeping an eye on the initiatives and what's happening, how can we impact and recover from the business. And those are all key areas. And financials, to me, are very, very key to a good, solid business operation, as we all know. The message here, our mission primarily falls within the whole state. We're a state organization which actually had 23 centers throughout New York State, and there are 8 of us downstate. So we work with business advisement, one-on-one. We work with education and research. We have a reach into the college in terms of experts if we need it. But we also have a research arm in Albany, which is our lead location in the state. And we can provide market research and any other specific areas to an individual client. Everything we do is obviously confidential. And we've been operating as a unit, and I was with AT&T at the time, since 1993. So for example, we've worked with almost 10,000 businesses, over 211 million in the community with economic impact, and worked with creating over 6,300 jobs. Having said that, each individual business, each individual practice is an important entity on its own. And that's why we have the one-on-one consultations. We have substantial resources. The SBA is funded through the Commerce Department, who in turn funds all the operations in New York State, for example, through the SUNY colleges and then the CUNY colleges and the private institutions that are in the city. We also have a reach out to other partners at the college, as I mentioned. I'm on the board of the Staten Island Chamber of Commerce, which gives us leverage to work with all the businesses on Staten Island, the Staten Island Economic Development Group, and we have a reach into Brooklyn, Manhattan, and other areas in the city. Each of my individual members, are basically part of organizations. So, for example, in addition to mine, I'm also a past president of our Rotary on Staten Island, which is very key in our contacts, our relationships, and how we're about to do business. So I believe the collegial atmosphere that you have over here with your dentist is a true representation of what we are able to do. And we do it at no cost because we're funded through the state and through the SBA operation. Real quickly, so we can move on, I know we have a tight schedule. I wanted to mention one thing that's happened recently. I didn't get a chance to introduce my folks in detail, but we can do that when they basically are given an opportunity to speak. For example, we just finished round 2, heading right to the PPP data. The summary for round 2, I think, is interesting. So we have a chart here. And what that says is there were $2.5 million, 2.5 million loans, I should say, over 188 billion, the B word, and lenders provided by 5,463 lenders. Why is this important? Well, there's still, if you haven't applied, if you haven't taken the initiative yet, or you weren't able to, there is still plenty of funding available. at this juncture. That may dry up soon if you don't apply, if you haven't. So the other point is important here too. It says the chart, if you can't read it, it may be an eye chart for you. Greater than 50 billion in assets, approved dollars were over $100 million. But then again, there are also small banks, the lenders, a lot of the smaller banks were quick to actually provide support for small businesses. So banks with less than 10 billion in assets, over 5,000, and they provided almost $60 million, $60 billion, I should say, of loans. I got to get used to the B word. Real quickly, the next chart, Megan, in terms of the PPP data on states. This may be an eye chart again, but just for relevant purposes. In the last go around, New York State was about fourth in the amount of dollars allocated to the state. This time, if you can see New York, over $18 billion were allocated, 190,000 loans. Second only to California, which obviously is a much bigger state, which received close to $35 billion. So that's the data. That's what's saying. But one more piece, the loan size for the second round. And I think this is very, very important. The first line reads 50,000 and under. There were 1.8, almost 1.9 million approved loans for $32 billion. That was 73% of the count. But then the next line underneath it, loans between 50,000 and 100,000 were 23 billion. So if you combine those two, about 86% of the loans were given to businesses under 100,000. In fact, the overall average loan size was $73,000. So in a nutshell, what's important as we start to think about it is each individual business has their own set of circumstances to deal with, has their own financial issues to deal with. We will talk later to give you an opportunity. If you need to contact us for one-on-one personal support, we will be there. We'll give you the contact information and give you an opportunity to deal with us, as the number of clients I have mentioned before have done in the past, and we're truly appreciative of your listening right now. I'm going to turn this over to Mr. Joe Bottega, former banker, who basically is involved, and we'll talk a little bit more about the PPP. And Joe, I'll take this over to you. We're also showing you certain links that you can get and how you may access. So Megan, if you could leave this on for a second. And Joe has been invaluable, joined me about 7 years ago, and has been a major asset to my team, which consists of 7 people, including myself, a small team, but I think we're very impactful. So Joe, let me give you the mic. Joe?
Joe, if you can unmute yourself.
Joe, please unmute yourself. Megan, can you send him a message? What Joe is going to talk a little bit about.
Okay, I'm unmuted. Dean, thank you very much for the introduction. And Dean, I appreciate the information that you provided. Dean made a very valuable point to the effect that there is still some stimulus money in the PP program left. For those of you who have not applied for the PPP program and are in need of funding, I would do so as quickly as possible. For those of you who are on the webinar this morning, in speaking to Dr. Dayani, I understand that a number of you have already received PPP funding. And for those of you who have, congratulations. But in the meantime, for those of you who don't know what the PPP program is all about, I think we should define what PPP program really is. The PPP program, basically speaking, is a loan, okay? It's not money that's going to be given over to you. But the actual purpose of the PPP is for employee retention. That is why the funds are available, and that's how they're going to be used. The actual small business deal is not with the SBA, however, it's with the bank. The SBA will actually set the rules, but the bank will actually interpret the rules and apply them. For those of you who have already received the PPP funding, It's very important to make sure that you review the documentation, and before signing, I would suggest you actually review them with your banker to be sure that that's the amount of money that you're actually getting, and also the amount of documentation that you need to provide at the time of finalization of that particular loan. Okay, Megan, that slide, I'll continue on. I just want to explain a couple of those links. The first link is information that you could click on to look at the SBA funding resources. The link below that will give you more information pertaining to the Paycheck Protection Program. The PPP checklist, which we'll go over in a little while, basically speaking, is information about what expenses are eligible for possible forgiveness, as well as the actual information pertaining to payroll. Okay, Megan, if we can actually get on to the checklist.
Mm-hmm.
I'll go back to the other slide in a second. But if I would just, divert your attention to the checklist and take a look at the actual documentation that you'll need to provide when you actually finalize your loan. For employers with employees on payroll, all eligible expenses to be accounted for would be wages, cash tips or equivalent, commissions, other forms of compensation, healthcare benefits, insurance. When I say insurance, I'm talking about health insurance, the group insurance, payment for vacation, parental, family, medical, or sick leave, payment of any retirement benefit, payment of state or local tax assessed on the compensation of the employee. Now, Megan, if I can just get over to the excluded payroll costs. The excluded payroll costs are compensation of an individual employee in excess of an annual salary of $100,000, prorated for the period of February 15th to June 30th, 2020. Also excluded payroll costs include payroll taxes, railroad retirement taxes and income taxes, any compensation of an employee whose principal place of residence is outside of the United States. Additionally, qualified sick leave wages for which a credit is allowed under Section 7001 of the Families First Coronavirus Response Act, or qualified wages for which a credit is allowed under Section 703 of the Families First Corona Response Act. Megan, can we go back to that prior slide for a second? Above before that. The forgiveness guidelines. Forgiveness guidelines has not yet released the final rule. However, loan forgiveness in terms of time frame, we're talking about equal to the amount spent by the borrower during the 8-week period following disbursement of the PPP program. In other words, what we're saying is the fact that once you get your loan and once the actual loan is dispersed in your bank account, that's when the clock begins. You have 8 weeks from that time period to actually capture your initial head count prior COVID, as well as to spend that money during that 8-week period to actually retain your full complement of employees. Okay, you have 8 weeks from that time period. Okay, Megan, next slide, please. Okay, we talked about the employers with actual employees. Now we're going to go into the actual PP checklist for sole proprietors, independent contractors, and self-employed individuals. With sole proprietors and independent contractors and self-employed individuals, you need to show proof of payments of any compensation or income of a sole proprietor or independent contractor. If that's in the form of a wage, a commission, net income, and with the net income, you should be seeing a Schedule C. If you're an LLC, you're filing a Schedule C, and you must provide that to the bank, okay? The bank will not accept anything other than a Schedule C for a sole proprietor, okay? Other eligible expenses, you can be using the 25% for eligible expenses. That would include interest on the mortgage obligation incurred in the ordinary course of doing business, interest on other debt obligations incurred previous to February 15th, 2020, rent on a leasing agreement, okay, which includes a copy of a current lease and proof of rent paid, payment on utilities, and that includes bills and payments made for electricity, gas, water, transportation, telephone, internet, and other information. Now, I might inform you that those utilities must appear on your 1040. Okay, they must appear on your tax returns, and you must provide at least proof of documentation to the banker insofar as your electric bills and your gas bills at the time of the application for your PPP program. Next slide, Megan. Okay, now when the actual PPP program was provided for the small businesses, it was not intended to be a lifeline, okay? You can't really use that money primarily to, pay suppliers and to use it for other purposes caused by the coronavirus. It's intended to retain employees, okay? So you may feel that you may need additional funding. For those of you who already have a relationship with the SBA, you may be able to get perhaps possibly an express loan, okay? Now, the express loan enables small businesses who currently have a relationship with the SBA the possibility to access up to $25,000 quickly, okay? There's information on the link that I provided for you on the SBA website that'll provide more information. In my conversation with Dr. Dayani, I mentioned also there's other lenders out there that perhaps might be considerate of other opportunities for you to get more funding. One of them is Pursuit Lending, okay? PursuitLending.com. I've referred a number of my clients to Pursuit to get the paycheck program, and a number of them have already got it. I might also add BetterFin, BetterFin. BetterFin is another lender that would actually match up the borrower with an SBA lender. And as well as Bluevine. Bluevine has also been very good in terms of being able to access PPP funding for several of my clients rather quickly. So those three particular lenders may be opportunities for you to at least reach out to for further opportunities. Pursuit Lending, Bluevine Capital, I might add too that Main Street Lending is an actual initiative that will be actually launched very soon by the Federal Reserve, okay? Main Street Lending will provide large loans. The initial initiative for the Main Street Lending was going to be, the minimum loan size was going to be $1 million. They have scaled back that particular loan amount down to $500,000. That has not yet been launched, but hopefully will be launched very soon. In the meantime, I'm going to be on this call for a period of time, and I will be here throughout the day. If anyone wants to speak with me after the presentation, or while I'm a panelist after the webinar, I'll be available to speak to any one of you at this point. Okay, and thank you very, very much. And I'd like to introduce Mr. George Telmany. In his former life, he was a former business owner. So George, to all yours. Thank you.
George, if you could unmute.
There I am. Can you hear me now?
Yes.
Okay, great. Okay, thank you for having us, Dr. Dayani, and thank you, Dean and Joe and Megan for putting this all together. So what I want to speak about is something that is very important for your recovery. It's a tool. So I've been with the SBDC, I started 26 years ago. So I found that this tool of cash flow projections and of cash flow pro forma is a critical tool for understanding how you would go forward. This is such a unique situation. Everything is very changeable. One of the great things about this tool is it's fairly simple. It's addition and subtraction. So Dean and I had worked heavily with Joe on Superstorm Sandy recovery. Now remember, this will be a process. Superstorm Sandy recovery took years to get back for many people, and programs continue to come out. So I want to alert you to think about reaching out to the SBDC because we will be aware of programs as they come. So let's get to what we're talking about today, which is cash flow projections. So the goal here is, by using this tool, is to gain an understanding of how much money you could need to go forward. Your goal is to get to a break-even point of where you have enough income to cover all your expenses, including your salary. So, and once you get to that point, the goal is to move forward to your previous income levels prior to COVID-19. Another key issue here is, how will you utilize your economic injury disaster loan and the PPP, which are the two main federal loans right now, to cover your expenses until you build up to necessary income levels? So again, when you have shortfalls, which will be for certain, it's happening now, but will be certain for a period of time till you get up and running, this tool will help you. It'll also help you understand if you need additional funding. So interestingly, 5 minutes before we started our session, I got a call from a dentist that I work with who received his EIDL loan, which was over 100 grand, and a PPP, which he had previously received, which was around 50 grand. So here we're talking about a pool of $150,000. If you need more money, this tool will help you do that. So let's move forward to that. Okay, so you see in front of you the financial worksheet. So this is the basics of a cash flow statement, a cash flow projection statement. So basically, one of the issues here is you want to look at everything on a monthly basis, because as you ramp up, there's going to be very weak months in beginning, and you can understand how you might do by experimenting. You don't need to stay strictly to one scenario. You want to experiment with optimistic and pessimistic forecasts. So you can begin with looking at the revenue, which is sales, although you don't know what that will be. Okay, so that's a big question mark. But once you open, you will understand what your operating expenses will be. Your rent is set, your staffing has a basic level, which will vary according how you bring people back, you know, telephone, internet, supplies, everything will be a little variable. Your utilities might be slightly variable, but you'll understand by looking at that what the expenses are. So in this list, you can see some sample scenarios of expenses. You may have different expense categories. It's important for you to understand what those expense categories will be for you. And like we said, you can reach back to us and we'll work with you. I will not be here after our session during the panel, but Joe Bottega and Megan will be. And the goal is for you to be able to contact us if you need consistent help going into the future. So in putting this together, you're going to create this sample of expenses and then an idea of what your income might be for that once you get going. Once you get to the point where your expenses are, where your revenue is equal to what your expenses are, you've at least hit the stability zone. Now, you may not have done this before. I've done hundreds, maybe over 1,000 of them. So, and at the SBDC, we're familiar with working with this. We have teams of people that can help you along the way. We have an advisor, Ed Pisco, who's very good at it as well. So we can help you through that. Your monthly totals can be adjusted so that your main goal when you're experimenting with this is to understand where break even is. Because once you hit break even, you do not need to use your idle funds, and your PPP funds can be used for payroll, which seems like if you use it for payroll, it will be forgivable. So understand that. Once you get your PPP and you're back in business, you're going to use it for payroll. Again, the final rules have not been written. Joe talked about an 8-week point from when you receive the funds. We don't know when the final rules happen, what's going to happen. And also, any funds that you don't use for payroll will be turned into a 2-year loan at 1%. So I do have some clients, after they do this, look at their cash flow and say, I'm not going to make money for a while, so I'm going to save my PPP funds for not payroll, for when I'm in business, and making sure that I can get to the point that I will be back in business. And that is where the cash flow performer works. So this is a very simple format. We want to keep it simple for you. It is important for you to keep it simple if you need to explain it to anyone. So this could be used as a negotiation tool by understanding that, oh, I need more money because this is what's happening. Okay? So you might be negotiating with your landlord. You may be negotiating with a banker, as Joe brought up, for additional funds. And in the case of the economic injury disaster loan, the EIDL loan, you may be negotiating with the SBA to modify the loan. So in reality, my recommendation to you is if you get an amount from the SBA that is your economic injury disaster loan, is accept the amount. And then you can go for a modification after. Because if you go for a modification, while the process is going on, you'll be kicked into a different category and the review may take time. If time is something that you believe you have, you can do it at that time. But it has been recommended to me, and I understand this from working with Superstorm Sandy, that it's best to accept the funds and then go for the modification after the fact. Okay, so basically that is what you're looking to use to help you understand your financial position and your potential financial positions as they go. I'd like to introduce Megan, our marketing counselor, advisor, and she will help you, and she will also help you understand how to get in touch with us, and we can assist you throughout the period. Thank you.
Thank you, George. So I put up on the screen our contact information.
the best way to get our entire team is through the email address listed. It's just the general sbdc@csi.cuny.edu. Myself and our office manager, Angela, we field out all of the inquiries that come in. You just simply have to fill out a quick form with your contact information. That's how we put you into the system to keep track with your updates as we make progress with you during this time. Basically, a lot of my role, a big portion of my role is our marketing, keeping our website up to date. The website on the screen as well has all the assistance information to keep up to date as programs are announced and updated. Keeping everyone up to date through email blasts and the social media posts. But something I wanted to just mention to your group is making sure that you are keeping your marketing up to date and keeping your record keeping in line as well, especially with these programs or the forgiveness guidelines. The biggest tip that we can give in terms of the forgiveness aspect, as the final rule is still being announced, is to make sure you're keeping record of everything, however you're spending the dollars, how you're spending your payroll costs. I have seen some comments come in that yes, you have up to 75% of the funds for the PPP to use for payroll, and the other 25% can be used for other expenses such as your rent or your mortgage, utilities for your business. So it's really important to keep record of how you're spending things. So when you do apply for the forgiveness aspect, you have all of your ducks in a row, and it'll be a lot easier to go through the process. Another big portion of record keeping as well is as you plan to reopen. It's a big question right now as to when that will happen, but it's good to have a plan in place. It's good to update your policies as well for your staff and for your patients. So making sure you're complying with OSHA guidelines, making sure you have a policy written out for PPP and social distancing and how you're going to keep your offices and your patient areas sanitized and maintained. It's great peace of mind for the person and for your employees, especially for those that will be coming back to work in your environment. They want to, you want to make sure everyone is feeling safe and comfortable. And it's, of course, important to stick with the guidelines that is given out by the city and our governor. So those are just the quick points that I wanted to touch upon. We are all here to assist you on a one-on-one basis, so please feel free to give us an email, and I will set you up with one of the advisors on our team, and we can go over your individual situation of your pro forma worksheets, your writing your policies and new guidelines for reopening and getting back together. I will take this time. There are just a couple of questions, Dr. Dayani, if you wanted to, I know we have a few more minutes before we go into the next speaker. So if you wanted to just touch upon a couple of these questions, we can certainly assist you while we have most of the team here.
Thank you, everyone. And we are going to go with shortly. Mr. Talamani is going to be leaving soon. Can you guys hear me?
Yes.
Yes.
I figure if there are any questions having to do with Mr. Talamani, we could maybe address it right now. And then some of the questions having to do with the legality of matters, we'll wait until Ms. Ennis goes next. The uncomfortable news is that seems like the chat room does not hold questions more than 4 or 5 at a time. And any questions from earlier had gone away. But I think the gist of it was, and feel free to, that if you feel that I'm not asking the questions right now, to repost them again and I'll present them. The financial only questions, well, most people saying, if I cannot go back to work, if I cannot see patients, either because the patients aren't there, I'm not ready from infection control perspective, for whatever the reason, I cannot go back to work. And the money for employees will expire in 8 weeks. What am I supposed to do? And I think there's a very good answer, but depending on who that responder is, the perspective is different. So why don't we just start with Mr. Talmani, and then Mr. Bottega, if you have any comments to make after that, and if Dean is on, we'll let him make the concluding comments about that.
Okay, well, what I think is, I mentioned this a little bit while I was speaking. If you don't know when you're going to open and there's no reason to pay employees and your financial position is not that strong, or it could be strong, but you can choose to not spend the money for payroll. You can save that money. As I said, I have a couple of business owners that are saying, I don't want to spend the money on payroll now. I don't know what's coming. I need these funds. So it's a decision that you have to make. And with that, I also recommend that each of you are talking to the ADA to lobby for you to make certain that if you cannot open, you may be able to hold the funds. So I think that that's a critical point for any industry, that they talk to their associations that have some lobbying political power that may be able to get the rules changed for certain industries.
And George, to jump on that last comment exactly, is that the forgiveness guidelines have not been completely published yet. So, you know, for industries like yourself, where you might not be able to open, you know, in a few weeks, and you only have this 8-week guideline, they might change the rules. They might make exceptions for certain industries, given the situation, if you're worried about the forgiveness aspect of it.
Right. I might add too the fact that the Congress is going to be reconvening very shortly, and they're going to probably take up that particular matter, George, with the possibility of extending out that 8-week period to a certain amount of weeks. Additionally, just getting back to the initial question, I think every situation is different and it's very unique. If there's an opportunity to really use that money, then I think you can, you know, either give it back if you wanted to, if you don't need it, or use it and pay it back at 1%. And you've got a 2-year period to pay it back at 1%. So, I mean, for all intents and purposes, you know, it depends on the situation for each and every individual.
Yeah, Joe, this is Dean. Just let me comment, and thank you, Doctor, for the attention on this. You also have a 6-month deferment till the end of the year. So, so that's important to understand the implications. You're in the driver's seat. You need to know how badly, you know, you would need the money and when you would pay it back. But think about it. If you're talking about 1%, and I'm not throwing anyone's money around, but I like to look at finances very, very pragmatically. It's a 1% loan. It's almost free money. So think about that when you're starting to look at, you know, the implications of what this is all about. You have to look at your situation individually and holistically.
Right.
Let me jump in for a second. Offline, Dean and I, we had this conversation that everything is on an individual case basis. You know, I may have been working for 40 years, I haven't, and I may have stacked away $10 million, or I may have just come into work last year. I have $500,000 in student loans, and I just started my business in debt, and guess what? Armageddon happened and I lost everything. So they cannot give us an answer that fits all, but what they have offered very generously is that call them, make an appointment with them, and review the cases with them. So that's something that you should take advantage of it. If I may paraphrase what you are suggesting here is, it's a money that if you get it and you give it away to your employees, you have to pay tax on that, correct? The employment tax.
I believe so.
So you're on a net loss over there. Whereas if your employees are collecting payroll unemployment benefit, let them collect the unemployment benefit. It seems to be quite generous to begin with. On a different perspective, think of it as your rich uncle gave you the money as an investment. If you're spending $1 from that PPP to give it to your staff, that staff should really make you $4 or $5 back in return. If they're not doing that, don't touch the money. Set it aside for now. Is that a good assessment of it?
I agree. I agree. And each case, like you say, Dr. Pora, is different. So, you have to look at each scenario.
So they didn't tell us go become Santa Claus, give the money away to staff. They said spend the money to restart the business so that you're profitable. And if you don't meet that qualification because you cannot open it, keep it for now. Maybe you can invest it down the line, get a 5% return on it, and you're just paying 1% fee over it.
Well, the other side too is the cap on.
Any questions having to do with PPP before we go on further? Go ahead, Dean, please.
No, I was just going to say the other cap. I think I've seen some of the comments go by. The cap, of course, is $100,000. So when we're talking about employee salaries and what have you, including your own. So.
Okay.
That's okay.
One last question on my side. Let's say we open the office and things are just wonderful, and the virus surges again, and everything goes down. How would you say we should be planning for that? Because we don't know what is happening the next 12 to 18 months. And what if they come back and say, shut down again for another 3 weeks, 4 weeks, 6 weeks? What is your advice to us regarding the funds that we've gotten? Because we don't know there will be further funds down the road or not. It may or may not be.
Yes, that's true. Dean brought up a very good point. The PPP loan, you have 6 months to decide and, to even hold the funds and say, I have to make my first payment. So at that point, if you decide that you are doing great and things look like they're going to turn around, you may actually give the funds back. But in turn, you can hold them and it's a 1% loan. And if the virus comes back strong, you have this money in reserve, which is a very good thing. And when I talked about cash flow projections, Dr. Pora, you also brought up the point of looking at scenarios that are very optimistic and very pessimistic. Use those cash flow projections to say, what if things are really bad? Like you just stated, they can start back great, and then all of a sudden things become bad again. You can actually project that out, and you can then have an idea of how much money you might need.
So in other words, if I'm a young dentist, I just leased this beautiful office, 2 operatories to work on it. My rent is X. I don't know what it is. The very denominator is if they throw me out of my office, I've lost everything. So that's the one thing I can't lose on that one, the rents, the place where you're going to go to work. So that's something that may be on top of that list. What else is it that you may want to keep there? Because if I'm an unemployed dentist, theoretically, I might continue to collect unemployment, but the PPP may or may not come back down the pipeline again to help me with the rents downstream.
Yeah.
Okay, one of the key points that I neglected to mention that I wanted to mention is the critical aspect for every business is keeping the most important part of the business in contact. And the most important part of your business is your customer base. They need to become comfortable with you as they're coming back. So make certain that you talked about rent being a critical aspect. Marketing what you're doing from a safety standpoint could be very critical in bringing new customers and maintaining your customer base once you can come back.
I'm sorry, Mr. Talmani, by marketing here, are you talking about advertising on social media, or are you talking about communication with the existing patient pool so they don't disappear on you?
A combination of those, yes.
Yeah, one comment on that, George and Dr. Tamani. I'm a strong believer in communication, so I think I would answer both on that statement. It's very, very critical. I like to look at the scenario. I'm glad you brought up that scenario, by the way. I look at this as almost a business case analysis. You're doing a business case on your own business. So you're well aware you started back into business. But again, at that point in time, every one of your clients should be aware that you're back. And secondly, during that period of time, I know it's not an academic exercise. You have to look at your business and say, what would be my exit strategy now? Okay, over the next year and over the next 2 years, based on your financial stability, as to what would I normally want to do, again, to take care of what's the worst case. We talked about what's the best case, but what's the most likely case? And that's the one you go with, which defines where you need to be and what provisions you've made. So let's say your business goes back to normal, and maybe there's an opportunity to be able to put a safe haven amount of money aside to accommodate a short-term, relapse, so to speak. So, those are contingencies. Yes.
So in other words, if I'm a dentist, I'm going back to work, and I think I heard that about, I don't know this one, I think there was a percentage of about 10% of the people that caught COVID, they were healthcare providers, half of which got it from their patients. So what happens to me if I get sick and I'm out for 4 weeks? What is the plan to make sure the office doesn't disintegrate? That's another contingency you want to put in there, and that financially you're in a very sound place to not have to worry about it while you're trying to recover. Those are the projections that probably have to be worked in as well from now.
Yes.
Sure.
Mm-hmm.
Sure, but guess what? That's no different than what, God forbid, you would get sick, under normal circumstances. So it's a good way to look at it. It's the proviso you put in there that says the what if scenario could be happening despite what we hear, but I know it's important for you to consider that in my business, and I have to do that. And again, it's just a matter of planning, but considering it in your plan.
One other financial question, and again, unfortunately, it's running off the screen. In case I missed any significant one, please let me know. That most of the theme is the same. But the question is from Sharon Silver, says, can an independent contractor receive PPP loan and use it to pay herself?
I'll answer that question, Dr. Dayani. An independent contractor can apply for the PPP program, but the independent contractor must be on a Schedule C, must provide a Schedule C. And the independent contractor must show a net income that's profitable, okay? So the Schedule C income would be used, divide that by 12, and multiply that by 2.5 to give you the possible loan, the loan possibility. Okay, so in other words, if the independent contractor had a net income of $20,000, divide that 20,000 divided by 12, and that figure times 2.5, and that should be the actual possible loan that they could apply for. But they must have a Schedule C, and it must have eligible expenses that are on that Schedule C.
Thank you all. Thank you very much for the time you've given us. Clearly, you've put a lot of time preparing these things. There is obviously a lifetime of experience that goes behind it. Many thanks for your help, every one of you guys. It is 11 o'clock, so a few minutes past 11. I wanted to introduce to everyone Ms. Felicia Ennis, an attorney who's going to be helping us from this point forward. She's a partner at a law firm of Warshauer and Bernstein. She works full-time in the city, and her specialization is in employment law. She is also a litigator. She does commercial litigation. Been working in this area for about 25 years in various cases, from discrimination to sexual harassment, breach of contract, and retaliation, wage, hour laws, family medical leave laws, and wrongful discharge. The experience is quite extensive, and in the past few weeks to few months, I know that you've spent a lot of time talking to various groups with issues revolving around COVID-19, and you're pretty up to date on the laws that are happening in New York State. She also has appeared as a guest show in various radio shows. I am going to turn the microphone to you, Ms. Ennis. Felicia, thank you for being with us this morning. And we will have another Q&A question. Some of our consultants will stay on so they can answer remaining questions at the end of the hour again. Felicia, thank you for joining us.
Thank you, Dr. Dayani. And thank you to the other distinguished panelists. It was very informative to listen on your professional perspective of the PPP loan. I know myself and other members of my team back at Warshaw Bernstein have spent a lot of time poring through the regulations regarding PPP loans and loan forgiveness. And I know it's on the top of everybody's minds in terms of how all of those guidelines will apply to them. So I do appreciate your professional perspective on that. I found it very informative. I'm going to talk a little bit this morning about some of the other aspects of your return to work, since that's also been the tops of a lot of discussions lately. We've started to see other states reopen, and we here in New York State are at least in the beginning processes of a reopening. And so I wanted to discuss with you what a successful return to work model will look like, not just from you specifically as far as your dental practice is concerned, but also how that looks from a perspective of what laws and guidelines and guidances apply to your particular business. So we understand that the key now to any successful return to work plan is sort of understanding and acknowledging that it's not going to be business as usual. Your pre-pandemic business model is not going to be repeatable anytime soon. So each business, and again, I will echo what I heard these speakers talk about earlier, each business is unique, and each one of you will need to consider certain situational factors applicable to your particular practice. But I hope this morning to also touch upon some of the more general aspects of a return to work business plan that would be able to assist you in customizing a plan for your particular needs. And lastly, I'm going to talk this morning about some of the employment practices and policies, which you may already have in place for your business, but which may need to be updated now with new legislation that has been enacted as a result of the pandemic. So where I'd like to start this morning is with where we are in New York State. So this is something very current in terms of the governor's announcements yesterday about what's going to happen on May 15th, and that's this Friday, only a few days away. We've been hearing a lot about reopening New York State on May 15th, but as we now understand from the governor, this is going to be not just a phased reopening, and I believe there's 4 different phases of the reopening. This is going to be very regional specific. And what that means is that there are certain metrics that New York State has adopted in what is now being called its New York Forward Plan. And these metrics will guide each particular region of New York State in that region's reopening. So essentially we have a total of 7 metrics, and these metrics really at the core are based on infection rates and capacity, not just capacity for diagnostic testing, but also capacity for contact tracing. So the 7 metrics, as we understand them, consist of initially a decline in hospitalization rates, and that's really over a 14-day period. It's a 3-day rolling average. So in terms of regionally, we are looking for declines in overall hospitalization rates, and also declining death rates. And that's also over a 14-day period with a 3-day rolling average. The third metrics that New York State is looking at is a decline in new hospitalizations, and that is fewer than 2 hospitalizations per 100,000 residents, also measured on a 3-day rolling average. And then the next two metrics, 4 and 5, really deal with hospital capacity. So metrics number 4 deals with overall hospital capacity, which has to be at least at 30% of their total beds available before a phased reopening can start. And that would also then apply in metric number 5 to ICU bed capacities. And then finally with metrics 6 and 7, we are dealing with diagnostic testing capacity, and each region has to have their own capabilities in terms of testing the general population. And metrics number 7 is the contract tracing capacity. And I'm sure you've heard recently in the news how New York State has really stepped up its contract tracing capacity in conjunction with some efforts by the Bloomberg team as well as Johns Hopkins. But really, these are the 7 metrics, and they're based on CDC guidances and White House guidances that New York State will be looking to in order to determine a regional reopening. So where do we stand now? And that's the big question. We are downstate. Obviously, we are in one of the hardest hit areas of New York. So in terms of monitoring your particular region, New York State implemented a regional monitoring dashboard, and you can actually go on the dashboard and see where we are in terms of how many of these 7 metrics the New York City, Long Island, Westchester region has hit. And as of yesterday, what I can tell you is that New York City has hit some of the metrics. It's still having some issues with new hospitalizations and overall hospital capacity. So it has not yet hit those metrics, which are 3, 4, and 5 yet. And as far as its contact tracing capacity, all that was indicated yesterday is that that New York City is expected to hit contact tracing, hasn't quite yet made it. Long Island and Westchester are faring slightly better than New York City in terms of its metrics, but they're still not seeing the decline in death rates, actually, that would be needed for a phased reopening. So if you're curious to see where we are in terms of when we are going to start reopening our particular area, I would tell you to check the monitoring dashboard. And as far as we can tell, once we see that we have hit these 7 metrics, the phase reopening will begin with certain low-risk businesses, and I think they've already established which of those businesses are going to be allowed to reopen in certain regions in the mid and upstate areas. And those include some manufacturing, some retail, and some construction. And I am hearing this morning that there might also be some recreational businesses, again, low risk, who will be permitted to reopen. But when businesses reopen, the New York Forward plan that the governor set forth yesterday assumes that each business has a business plan in place that will enable that business to not only bring its workers back safely, but also will enable it to interact with its customers, or in your case, the patients, in a safe manner. So the 3 factors that the governor's plan assumes businesses have already put in place as far as their return to business plans are that they're going to have plans in place for the protection of their employees and customers. And again, those protections really revolve around some of the more general that we've heard, and I'll get to the more specific for your industry in a minute. But those general plans include certain social distancing protocols, certain screening measures, and specifically the reduction in density. And we've been hearing a lot about how New York State, and particularly in New York City, is really going to be emphasizing things like staggered work schedules and flex schedules for employees, because they really are concerned about reducing density. And it's not just the density that they're seeking to reduce in your particular office, but it's the density that they really need to reduce in terms of how people are going to be getting to work. And that includes, forms of public transportation and so forth, because those are really difficult issues that a population such as New York City is going to be facing. And that's why we can't really be flipping a switch and expecting everything to go back to the way it was. So there's the protections and the protocols that your business plan, it will be anticipated that you have those plans in place. And I'm going to go through just a checklist of some of those in a minute, but also a consideration that you've already assessed your physical workspace. And without getting too technical, because I know in terms of dental practices, you're already used to taking in certain infectious prevention measures within your offices and so forth. But really just, this is more about how to limit contacts. What are your plans and protocols from pre-appointment all the way through the reception area, the waiting area process, into your offices, and then exiting your offices. And these are the sorts of plans and protocols that New York State is asking you to consider. And then lastly, there will be certain considerations concerning flexible work schedules, again, changes to certain paid leave policies and practices that you have that you will need to consider. And again, I'll get to some of those details in a minute. So in terms of workplace protection and exposure reducing measures in your office environment, we talked again about implementing flexible work schedules, and that might not necessarily work for each individual practice. So again, these are considerations, these are guidelines, but you have to customize and you have to figure out what is right for your business. So what we didn't see in yesterday's publication from the governor are more specifics in terms of what my business model return to work plan should look like. But here I'm going to give you some ideas and some checklist items that can get you to think about these things, and not just thinking about them. New York State is really going to want to see you documenting them. And I know we mentioned a few minutes ago how important communication is during this period of the pandemic. And communication here will be key when it comes to how you will be communicating this information to your employees, because you want to give your employees the confidence that they have in the safety of your workspace, so that they will feel confident in returning to work for you. But you also want to give your patients the confidence that they want to come into your office. So for example, the other day I was given a prototype plan that another dental practice was using here in New York City to communicate with their patients. And what I found really effective in the messaging that that practice was sending to their patients was the emphasis on all of these different measures that were being taken, not just obviously to protect themselves in the workspace, but also to explain to the patient like what to expect when you come into our office, and what measures were being taken to ensure their safety. So a couple of months ago, I heard from some practitioners, I don't want to wear the shield, I don't want to wear the gowns. It's scary to a patient. So if I walked out with full PPE, isn't my patient going to be scared and think, wow, how really dangerous this environment is, maybe I shouldn't be here. But I think at this point, it's really the contrary. I think when they see that, and when they see that these are the things that your practice is really thinking about and planning, they will feel more confident coming back into your office. So these are a couple of things to think about. I know I've heard a lot about the virtual waiting room. I'm not really sure how that works if you have a city practice versus a more suburban practice, but certainly these are the sorts of things that I'm hearing about from other practitioners. I'm also hearing about how a lot of the transactional exchanges are going to be done either before the appointment, like, can I get your insurance information, and can I get you to fill out this form, this questionnaire, all before the appointment, again, to limit the amount of time any specific patient needs to spend in your office. And I know I've seen from the ADA, they have a good toolkit that has a lot of these forms and questionnaires that you can send to patients pre-appointment if you're dealing with a patient, obviously, that doesn't feel comfortable filling something out online or sending personal confidential information via the internet. There's always the phone, and you can engage that patient over the phone. But again, the messaging is so important, and I think that to start, doing that and to start reaching out to patients now is so important, but also think about your employees and think about how they're going to be feeling coming back into your workspace. And while a lot of them already feel comfortable with PPE and so forth, I think we're also seeing a lot of guidance that training is important at this point. So if you haven't had recent training with your staff, maybe before you do a more full and thorough reopening, you do a softer reopening. So your staff is also familiar with some of these new practices and protocols that you're going to be implementing. And in terms of protecting staff within your offices, and these again are some more general suggestions. I counsel a lot of businesses across various industries. And, a lot of businesses are struggling because while the model typically is sort of the open floor plan and everyone's sort of working on top of each other, that really is sort of contraindicated in terms of a return to work model during a pandemic. So what are some businesses doing from a practical standpoint in terms of separating employee workstations? Ensuring that there is enhanced sanitation in the office and work surfaces, considering certain barriers between workstations, such as the plastic barriers, curtains. Again, the staggered work schedule works when you're dealing with a more dense office space where workers are working on top of each other, and maybe not everyone needs to be there every day. And certainly if you do have some staff that can telework, maybe ask them to continue teleworking for the foreseeable future, again, to keep fewer people in your office area. The other thing that needs to be considered are the common areas of your office, not just the areas where procedures are being performed, but areas where your workers may be congregating, in kitchen areas, in break rooms, even in elevators. If you have an office in an office building, reach out to your landlord. I know some of my clients are saying that their landlords are really stepping up and reaching out to them to give them a sense of confidence that certain measures are being taken to reduce density in elevators and security checkpoints and things of that nature. But so these are some of the considerations that businesses across the board can take and certainly can apply in your particular practice. But you need to know also what's going to work best for you. In terms of what may work for your particular practice of dentistry, you also are aware that there are certain guidances that have already been issued by the CDC and by OSHA. And at this point, both the CDC and OSHA are still recommending, at least from when I last checked, that in terms of the practice of dentistry, we're still just dealing with emergency procedures only until further notice. Obviously, aerosol generating procedures are considered a very high risk by OSHA. And if you're familiar with the 4 risk categories that OSHA has, aerosol generating procedures are in the 4th or highest risk category. So obviously there's a need here and uniqueness to the practice of dentistry that the CDC and OSHA are paying particular attention to. So in terms of your preparations, while again, these are guidelines and these are recommendations, I'm seeing a lot of practices already implementing some of these guidelines into a return to work business model. So in terms of, some of the PPE requirements that OSHA and the CDC have been recommending for your particular practices, obviously initially that might have been difficult getting your hands on some of the PPE. Hopefully now that's becoming a little easier. But these are some of the guidelines that the CDC and OSHA have already published that you should really be familiar with. And again, but what I saw specifically with OSHA is that they are anticipating that this isn't just going to be business as usual in terms of, I already know how to wear my PPE. I already know how to use a respirator. I already know how to do, my procedures wearing face shield, goggles, and so forth. Well, that may be true, but they are emphasizing that you offer training to your staff to minimize their exposure and to really have, your safety and infectious prevention protocols in place before a full reopening. And in the material that I'll send out later on, we have like some of the resources to the various interim measures that the CDC has issued that do apply to the general measures that apply to all businesses, and then the more specific measures that apply to the practice of dentistry. And same as OSHA, OSHA has some general guidelines that apply it to your particular practices. And they also have specific guidelines that they've issued during the pandemic. So it's important, again, to familiarize yourself with all of these latest guidelines, because when it comes to reopening, when it comes to what New York State and local governments are going to expect to see from practices such as yours, is that I've thought about these things, I have these plans in place, I've already trained my staff, and we are ready to go. So when this region reopens, you will be able then to say that you have the model plan in place and you'll be ready to open. So those are sort of the environmental and operational controls that you should be considering in your return to work business plan. But in addition to some of those factors, just from a business perspective, and you're also employers, you also need to consider, like, what about the employees that work for me? How am I bringing them back? And what do I do in terms of the practices and policies that I have in place? Do they need to be updated? Because over the last 2 months, there's been, I'm sure as you're aware, a lot of legislation that has come down in terms of certain leave policies. This is sick leave for people who have COVID. I'm talking also about family leave policies, and these are leave policies for individuals who may have childcare issues at home because the schools will remain closed. And not just childcare issues, but also family care issues. Individuals who may be treating somebody at home who's sick or recovering from COVID illness. So in terms of addressing who you will be bringing back when you can fully reopen, some consideration should be sort of screening or just getting some information from your employees through the use of Q&As or questionnaires. And in terms of the use of questionnaires and what information you can elicit from your employees, because this has always been a very sensitive area from the EEOC's perspective, there are certain questions about medical conditions and so forth that you're not supposed to be asking employees because they have ADA implications on the American with Disabilities Act and also local disability legislation. What the EEOC is now saying in their guidelines is ask those questions. They want you to be asking your employees specific screening questions about things like exposure to COVID, known exposures, exposures through family members or acquaintances. So before you're bringing anyone back into your workspace, and this applies across the board, the local governments are going to be assuming that you are already screening your employees. And then obviously not just screening employees, but screening anyone who is entering your office. So you have to consider, you know, what sort of protocol am I going to have in place about screenings? And with respect to patients, as we discussed earlier, this can consist of a appointment screening and also a screening at the time of the appointment. For employees, it could be the same. I know there's been a lot of discussion about what type of screening, other than, you know, obviously self-reporting and questionnaire type of screening for employees. Like, can I take my employee's temperature? For those, you know, who may debate whether that is warranted or not, EEOC does say that you as an employer have the right to take your employee's temperature if that's what you are going to choose as part of your protocol. And I can say, with respect to the practice of dentistry, it is something that's recommended by CDC guidelines. So if you're going to have screening in place, such as the taking of temperature, you know, how are you going to do it? The EEOC says as long as you maintain confidentiality, it's certainly something that they are allowing during the time of the pandemic. So that's something to be considered from the screening aspects of it. You may also have certain employees that are considered high risk. And under CDC guidelines, you know, there are certain high risk factors that make people more susceptible to the virus. And those high risk factors include age, which is, I think, over age 65, and certain underlying medical conditions. Normally, as an employer, you don't necessarily have the right to ask your specific employees how comfortable they feel about coming back to work because they're in a certain category of high risk. But again, this is something that the EEO says you can at least have a dialogue with your employee about. It could be very important in terms of determining whether your employee feels that they are capable of coming back to work and feel comfortable coming back to work, and whether you necessarily want them back in your office. So after going through sort of the pre-screening processes of who may be returning to your office space, and then considering some of your leave policies and practices, the next thing that you want to also consider is whether you want certain employees being brought back who you may have furloughed or put on unpaid leave so that they're now collecting unemployment benefits. So to the extent that, as we mentioned earlier, or I heard mentioned earlier, that there are some employees that are collecting unemployment, they may be very happy collecting unemployment right now because under the current benefits structure, they're not only getting their state unemployment benefits, which maxes out at $504 a week, but beyond that, they're entitled to the pandemic unemployment compensation benefits, which is an additional $600 a week. And the PUC, or the pandemic unemployment compensation benefits, apply to not just individuals who are receiving full unemployment benefits, but also apply to people who have qualified under partial unemployment benefits. So until the end of July, these pandemic unemployment compensation benefits will remain in place. And whether or not you're on full or partial, you're still getting an additional $600 a week from the government. So that could be an incentive for certain employees to not want to come back to the office. So this is obviously, an opportunity now to have that dialogue with those particular employees to sort of gauge where they are. We've heard obviously this morning about the PPP, and that the PPP is intended to apply to payroll. So if you do need to bring employees back because you've received your PPP and you want them on your payroll, just so you understand the recent guidelines from the U.S. Department of Labor, the U.S. Department of Labor understands that basically employees, especially employees under a certain salary level and in certain states, may be receiving more in unemployment than they are from you. So what the Department of Labor has said is that if there is a written offer to return to work that is rejected by an employee because the employee prefers not to come back to work and prefers to remain on unemployment benefits, and the Department of Labor says that that employee may become ineligible to continue to receive unemployment benefits. So if you do give someone an offer to return to work, we are recommending at this point that these offers, obviously, that you're notifying your employees in writing for this purpose, and also just to give them sort of notice that if they are receiving unemployment benefits, when they need to come off those benefits back onto your payroll, and that they'll no longer be eligible to certify for the unemployment benefits. So those are some of the factors that practices need to consider in terms of employees returning to work. There's also, I also receive a lot of questions from business owners who don't expect to be up and running at full capacity when we do ultimately go back to work. And the question is, can I bring back an employee part-time? And there are certain ways of doing that where you can bring an employee back part-time and that employee may still be eligible to continue to receiving unemployment benefits, including that $600. And currently the guidelines under New York State unemployment for partial unemployment eligibility, they have to work less than 4 days a week and earn less than $504 a week, which seems like a slightly small amount for some, but those are the guidelines under just general partial unemployment qualifications. But New York State also has something called the Shared Work Program. And this is something that was recently in the news because the federal government just announced that it was funding state shared work programs so that if an employer decides to apply for a shared work program and employees are receiving partial unemployment benefits through that program, that it's 100% funded by the federal government and that it's not coming out of anyone else's pockets or charged against an employer's unemployment account. So that might be another consideration. There are eligibility requirements for shared work programs. Employers have to apply for the program itself, and there's something called the 60-20 rule. And the 60-20 rule essentially is that you can reduce salary and hours by a minimum of 20% and a maximum of 60% in order to be eligible for the shared work program. The shared work program, according to the latest fact sheets that I've seen on the unemployment work site, don't seem to have any restrictions in terms of how much that employee may be receiving from the employer in order to be eligible for partial unemployment. They look more towards how many hours are being reduced by the employer and whether it fits within that 20/60 model. So that might be an important consideration for your practice, for your employees, at least for the foreseeable future, through July 31st. If you just bring them back on a part-time basis, then they may still be eligible to be receiving some partial unemployment benefits plus that additional $600 under the PUC. So those are, again, are just some of the considerations that you need to factor into your return to work plan. So just to summarize again, and going back in terms of what are some of the key features of the return to work plan. So obviously there's, the assessment feature. You have to have assessed your engineering and operational controls. And again, there's guidelines for you under the CDC and OSHA for some of those controls, from your own specific business model. You have to determine who am I bringing back? Am I bringing them back in a staggered way? Am I reopening just 25%, 50%, so forth? How many employees do I absolutely need to have in the office in order to support my practice versus those that can remain working from home, teleworking? And then physically, when I reopen, what is my physical office space going to be looking like? So those are important features that New York State expects you to have in your business model. And then obviously there's the screening aspect of how am I screening people coming into my office space? How am I protecting my workers from individuals coming into my office space? And how am I protecting my patients? So these are really important factors that you need to be looking at now. And again, as I mentioned earlier, the messaging of all of this in terms of what information you're getting out there to your employees, and certainly what information you're getting out there to your patients, can be very critical at a time when there's this fear factor out there that there are individuals who are really going to be hesitant and reluctant to start either going back to work or going back to you for their procedures. So the more you can communicate with them about things like, what we've been discussing and what you can be thinking about, I think certainly that can go a long way in terms of when you actually reopen. And then obviously, the various aspects of your specific employment policies that you have in place and that you will need to have in place when you reopen. All of these new leave policies require the posting of notices in your workplace. They are available from the Department of Labor websites, but when your workers come back into your workspace, both New York State and the U.S. Department of Labor will assume that you have the required posters up and that you had already communicated to your employees what their various rights are under the leave policies that exist specifically for COVID, and those specific leave policies that might only be temporary and due to expire at the end of the year, plus the more permanent leave policies that New York State and New York City have already implemented. And for those not aware, New York State will be implementing mandatory paid sick leave, and that was recently passed. I know there has not been a lot of discussion that I've seen about the fact that New York State has enacted legislation that will require all state employers to now provide for mandatory paid sick leave to their employees, and not specifically COVID related. So this is a permanent measure, and that new legislation is going to be effective at the end of September. And I think the use of sick leave will be at the beginning of next year. But obviously, employers in New York City and Westchester are already aware of the requirements of paid sick leave. And I believe those paid sick leave requirements will be very similar under the New York State legislation, but obviously we're still waiting for the final guidelines there. So there's a lot of things to consider, obviously a lot of planning on your part, but with good, thorough planning, I think, we're looking at a more successful reopening and hopefully not a situation that I know a lot of healthcare professionals are concerned about in terms of if we reopen too soon and without the appropriate corrective measures in place. We don't want to wind up having to get shut down again because of another outbreak. So we're looking to avoid that. And obviously, these are some of the tools that you have to work on now when you have, at least some of the time that you can then implement when you are ready to fully reopen.
So much, Felicia, for such a comprehensive summary of everything. We have this saying, I remember when I was in anatomy classes saying, we're going to open a fire hydrant and not take a sip from it and come back for the test. And so that's what it felt like. And again, shows how much preparation you've put into this one. Clearly, not everything we're going to be able to absorb in one shot. So I do want to remind everyone that Felicia and the group from SBD Development Corporation have said that they are available. I will pass on the information from the panelists later on, either today or tomorrow, so you can communicate with them. We discussed it earlier that it's on a case-by-case basis. Each one is different. What we don't want to do is that to go in and prematurely have to stop again, because as we all know that these are, they have an expense associated with them, both emotionally and financially. Just housekeeping rules before we go back to Q&A. We are delighted that we were able to bring in such talented minds to all of you today. And there is no expectation from anyone except for we're going to send out a survey. The reason we've done well in this forum by bringing you material that is appropriate to you is because thank you to all of you. You've been very vocal about what you're interested in and what you want to hear, and we've been able to bring that back. So there will be a survey that goes on later on this evening or early in the morning. Please take a moment to fill that out. We are good with our surveys. We make sure you don't have to spend more than a minute or two filling it out, so it's down to the point. Give us feedback about how you felt about today's presentations. I will leave a box in there for questions that have not been asked properly during the Q&A, so you could pass them through, and we will try to answer them. We do have a chat room on our WhatsApp platform that's open only to the dentists who have been coming to these webinars. Of course, today we've reached numbers as high as 120 people. We'll send a link to that WhatsApp group as well. So if you want to come in and communicate things that are dentally related and practical, do I put in this kind of an air humidifier or that kind of a filter versus the other? Those questions can be asked from members of the group and answered from that. You're not limited to these 2 hours here. The questions that you'll put in on the survey, I will pass them up to our expert panelists, and we'll try to get you some answers. If there is interest from group, again, we may come back and have a similar session not too far into the future. I know a good friend of mine, David Weinstein, and I see he's here, and we discussed that we might have a more of a worksheet practice kind of a session one day that we'll put up and go through these pro formas and opening and getting ready for recovery with people who are interested in that. We are having a very robust scientific, dentally speaking, continuing education. Our own Valentina will continue next week in our theme for the month of sleep dentistry and apnea. It's focused on prosthodontics. She will talk along with Katerina Cohen, who has a board certification in dental sleep medicine, as well as our own Ilana Grossman. The topic of opening, I know this, that I had spoken with Felicia offline before, and of course I got tremendously more information, and yes, it can be overwhelming. Feel free to reach out. We did open our office just so that EOI has opened up, and we had to go through several rounds of rehearsing with our own staff members. We're open 3 days a week, and I saw questions coming up in the chat room that can we test our patients. At our office, we are trying to have every patient that comes through the door tested in advance. We try to follow the engineering protocols, the administrative protocols, and have them tested before they come to our office. Feel free to reach out to Felicia if you have any questions how to implement it, or to our chat group if you need links for information. And hopefully we will ramp up in our office to 6 days a week of emergency services. Other housekeeping rules. Still, a lot of you guys have your pseudonyms as iPhone and iPad. If you need to get credit, if you need the credit, please in the chat room put your names down and we'll record them. Let me open the floor to questions. There were a good number of them that have come through. Let's see. There were questions. I don't know, Megan, I think your team still is on. I walked away from that screen. There were questions about PPP, and the gist of it is they're an S corporation, they're getting a W-2, they are an employee. A, are they qualifying? Do they qualify for getting paid by themselves? And B, is there some kind of a formula that somebody will come along and look at it and say, hey, you were supposed to have, I don't know, 50,000 in payroll over 2.5 years, and most of it under 100,000, most of it went to yourself and your employees. 25 employees got a little bit of money. Does that matter how much the employer gets paid compared to employees? And the other question is, would be, is it that we need to, in order to qualify, and recognizing that it is an interim rule that they have, in order to qualify for forgiveness, recognizing it is an interim rule that's put in place, when they're saying you need to reach the amount of employment as before the program hit, does it have to do with the dollar value of money spent on payroll, or does it have to do with the number of people working on for payroll? Anyone who wants to go first?
Sure. So I took care of a couple questions in the chat if anyone's able to scroll through it. But basically, it's based on your payroll records. So if you yourself are on your team's payroll, you are eligible to pay yourself up to the $100,000 cap. Joe, correct me if I'm wrong, but I don't believe that there's a certain percentage per se as to how much you can pay yourself. But it is based on the 8-week span, and the forgiveness guidelines are based on the head count. So you have up to, you can't exceed 25% of decreasing your payroll, your full-time payroll employees. That's the big portion so far in the interim rule, is that it goes based on your full-time employee head count. Joe, just unmute yourself.
Okay, Megan, you're correct. Yeah, going forward with respect to what Megan said, you need to have had your pre-COVID head count in order to consider to be eligible for forgiveness. Now, as far as the salary is concerned, if you're going to pay yourself a salary, you can't go beyond $100,000. Okay. In other words, if you have if you're a W-2 and you can qualify that by your payroll records, you cannot go beyond $100,000. Okay.
Okay, Ms. Ennis, do you have any comments on that front?
In terms of payment of salary, I think that's absolutely correct, that the $100,000 cap would apply. I understand that there are certain, I guess, non-cash payments that could also be made that you could also apply your PPP loan to not just direct cash payments to your employees, but also bonuses, certain 401k contribution payments, and certainly payments for things like paid sick leave and so forth that you are paying can also count towards the PPP loan usage.
Yeah,
And all
absolutely
of that collectively needs to be under 100,000
No,
per employee.
the salary, in my understanding, and Felicia, by all means, correct me if I'm wrong here, and the salary cannot go beyond $100,000, but your eligible expenses, which was indicated by retirement benefits or paid vacation, can be inclusive of that.
Correct. In other words, you can the salary cap is at $100,000, but
right.
you can go beyond that if you have other benefits
That's
that
right.
you're paying for your employees. They
That's
do
right.
not have to fall under. They're not included in that salary cap.
That's right. Exactly.
Right. So in other words, I know certain businesses that are paying certain bonuses, certain emergency workers are collecting pandemic bonuses and hazard pay and so forth. And these are the things that are in addition to salary that could still be that you can still apply your PPP loan to.
As far as the actual eligible expenses are concerned, yes, that's correct. And payroll expenses, that's correct.
There is a question, and I am no expert in this area, and I'm not sure if the question is sound or not. Somebody's asking privately that, can you make a contribution to an IRA for yourself, which does not include your employees? I didn't know that we could have, why don't you answer that question, anybody, if you knows that. Can you make a contribution to an IRA for yourself, but it doesn't include your employee? Can you guys hear me?
I can hear you, but I can't answer that question.
I thought, and that's why I was not sure if that's correct, for an office retirement account to be valid, I don't know what the correct word is, it needs to not discriminate and include all the employees in there. You are, I believe, allowed to have an IRA outside of your office. But I assume because the PPP was based on your office payroll, the calculation of that, it may, if the IRA is something that kind of like meets the muster, then they can use that. If it's not an office IRA, I'm not sure that you could do that or not. But please, if anybody knows the answer amongst the audience, feel free to unmute yourself and make comments about that.
Yeah, that's an interesting question to the extent that you can make 401k contributions that you can apply PPP to, but if you can make an IRA contribution for yourself, I'm not sure if I've seen in any of the SBA guidelines in terms of whether that would qualify for the appropriate usage of the PPP funds. But again, as we've been hearing throughout this morning, I mean, these guidelines keep coming. So maybe look for that in the new forgiveness rules that everyone is still expecting to see.
Okay.
Nima, Jonathan Neiman. I spoke to my retirement person who runs my business 401k profit sharing plan, and she said basically that we don't know, but she said that in her community they're doing the same kind of like group think, and they have been saying that business expenses, stuff that like qualifies, like you said, does not discriminate against the staff. So stuff that we would normally pay out of the corporation, like a safe harbor contribution, or if you haven't funded your 2019 portion of your 401k, there's talks that can be used for eligible dollars, which if you haven't done it already is a really great benefit. But specifically the IRA, since I have a 401k in the office, I didn't ask, so I don't know.
Okay, thank you. There was a bit of an anxiety between people saying that the chat is disappearing. We tried to save some of the questions and we try to release it later on in our WhatsApp chat, and we'll send a link to that as well. If we are unsuccessful at doing that, there may be, and we're hoping to have another follow-up session to this in a few weeks later on, especially that the situation seems to be dynamic and things are changing anyhow. Any other questions that you guys feel that's worth repeating again that hasn't been said? I know some of the questions seem like the same.
Can I say something?
Jonathan Marcos, please go ahead.
No one addressed the tax credit being offered to small businesses as a credit against retaining employees, which is a really important issue, which is not a loan, it's not forgivable, it's a straight out tax credit, which is a refundable tax credit if not used. I want to know how come no one even addressed it, because it is another option for dentists. Is anyone even aware of that?
I wasn't. Please tell us more.
The government is offering a tax credit of up to $5,000 against each employee that you retain. It's a credit against payroll taxes, but if not used, if your payroll taxes don't cover it, the balance will be refunded to you as a direct tax refund. And that's $5,000 per employee. It's part of the CARES Act. No one really addressed it, but someone should look into it, because my accountant told me about it as another option if you don't want to get involved in taking out a loan, which as of right now, no one knows what the answer is going to be at the end. So people are taking this money, and the government could change the rules, and the rules may not very well be favorable. But this is definitely another option. The fellow from Staten Island, are you aware of that at all?
Yes, we have. I have heard that. But, to your question, Jonathan, we're still dealing with the fluid situation. We don't know how that would be actually addressed in terms of this particular PPP program. We were brought on today to address that, but your point is well taken, and that hopefully will be addressed when we get final.
It's been out for a while. I mean, the program's in effect, and it's another option if you don't want to get involved in the PPP. It's a tax credit, which if you have employees and you retain them, it's really good.
Is the tax credit automatic, or do you have to apply for it?
Automatic. Automatic. It'll be applied to payroll taxes, and what's not covered will be refunded directly to the tax
But that's not if you get PPP, correct?
I believe. I'm not sure. I believe it's in addition to PPP.
That's the point. That's the point. We don't know.
I believe. Well.
So the best advice is speak to your CPA about it then.
I believe it is.
They don't know.
I believe it is. You can get it both. I think you can get both.
Well,
I think based on the original CARES Act, you could not qualify for both. So in other words,
Correct.
if you decided to take the tax credit, you would not qualify for PPP. So at the time, and again, this is a very fluid situation, businesses that were applying for PPPs were hesitant to start taking the tax credit in view of the fact that, the language of the statute seems to suggest that you cannot do both.
I'm not sure. I mean, I've read both. I mean, I'm not sure my accountant read both, but it's definitely an option because the PPP, no one knows all the rules right now. But the tax credit that's pretty clear. It's just an option, I think, that should be discussed.
I think at the end of the day, Jonathan and everybody else, if you have a business that is a business, not a charity, that's working and you're making a living off of it, that is safe, and you're not going to put anybody at risk, you should take advantage of all the tools that they've provided for you and go back to work. If not, then use any of the tools that are available, whichever works best for your business, and take advantage of that. And I'm glad you brought that up. It might be time in about a few weeks to bring in an accountant to help us out with the conversation as well.
Definitely.
Joe, are there any comments that you wanted to add before we start to wrap up?
Yeah, I have
Nima, can I say something?
Let's say what's going to go ahead first, please.
Can I make one comment with respect to what Megan brought up before with respect to keeping good records? There was a question that was posed from Dr. Daniel Noor about the fact of having a separate business checking account for PPP funds. Well, I would suggest this. I would suggest having a business checking account for your payroll and your operational account, so that when you actually provide documentation to the bank for the eligibility for forgiveness, at least you have a seamless process where you have your separate funding for your payroll versus your separate funding or funds for your capital expenditures for your business. So I just wanted to clear that point up.
Okay. Felicia, are there any concluding remarks that you want to add before I return to Megan?
Yeah, I just had one more remark on, I think there was a question that I saw in the chat room about whether payment for paid sick leave can also be applied towards PPP. And the answer to that, when I mentioned paid sick leave, I meant the employer's own policy for paid sick leave, and not if they were paying out for paid sick leave under the Families First Coronavirus Response Act, because employers that have to pay paid sick leave under the federal act will get a credit for that, and that's separate and apart from applying any proceeds of PPP towards that paid sick leave. So that would be exempt from usage for PPP because of the credit that the employers are otherwise getting. And I think, this is a great forum. Dr. Dayani, I just wanted to thank you again. I think there's no one size fits all, but I think this was very informative and certainly getting a very robust conversation surrounding PPP and other return to work issues. And I really appreciate you inviting me onto this forum.
Thank you for joining us, Megan. Thank you for helping moderating. Any concluding comments from you, Megan?
Sure. Thank you again for having us. If you have any specific questions for us, for our team, or for the SBA directly, we can certainly compile your group's questions and either answer them ourselves or send them over to our SBA representative and get the information that you need as it becomes available. So, specifically, just as an example, the tax credit question, we can send that over to the SBA to clarify if you can use that in line with other programs or what the specific questions are. But we're here to assist all of you guys at this time. We will, I'll send you the worksheet and our counseling form. So again, our services are free of charge. All information discussed one-on-one is kept confidential. So feel free to connect with us, and we're here to help.
Yeah. Again, Dr. Nima, thank you. Dr. Dayani, thank you so much for having us.
In conclusion, thank you, Mr. Bodega. In conclusion, whether you want to call it Uncle Sam's gift, you want to call it PPP, could be your hard-earned dollars coming back here. One thing is for sure, that without good people at SBA, SBDC, and Ms. Ennis, none of these would have been possible, and none of these would have been as effective in our practices without your advices. So on behalf of all of us who are on mute and can't speak right now, many, many thanks. I hope that you come back and visit us again with updates, and we are all very grateful to you. Thank you, and enjoy your day, everybody.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.